Hello everyone, and welcome to my presentation. My name is Lucas Bustello, and today I'm going to be presenting on why a smartwatch can save your life. So, I chose this topic because I believe that wearable devices are the next big thing in healthcare. And I say that for a couple reasons. On the first hand, they're creating an incredible impact in the fitness world. They're giving users their own power over their own health and allowing them to monitor their progress day by day, rep by rep, calorie by calorie. And on the other hand, they can be made inexpensively if you factor out a lot of the unnecessary applications or commodities such as luxury. They can be perfectly applied to the healthcare world. Now, these wearable devices measure, as I said, a numerous amount of things. Mainly, they focus on calorie expenditure through physical activity such as running. The main one is steps taken each day, but you can calculate anything. It has settings for boxing, for swimming, for Zumba classes, you name it. It pretty much has it. And on the other hand, it comes with access to a mobile app that connects to your device via Bluetooth and allows it to take that calorie expenditure and combine it with a nutrition log that you create day by day and input what foods you've been consuming and when, and it completes the calorie expenditure equation in order for you to know if you're on track to gain weight, to lose weight, if you are in need to up your calories or do more cardio. It really gives you that visual element that some people need because, either you don't work out enough or you just eat too much. And this app and device really helps you with that. And the third component, it tracks your sleep, which not a great amount of people do not get the right amount of sleep each night. So with that said, it really puts power into the consumer's hands. And I believe this can be applied to the healthcare setting because as a hopeful for a healthcare administrator position, I'm always going to be looking for the most efficient way to implement things in the hospital and how to minimize costs and create that best effective method in the workplace. And I believe wearable devices are going to lower the cost of healthcare and provide a sense of support for people who are dealing or managing with inconveniences in their lives or with their disease or condition. And it's also going to improve the quality of healthcare that doctors and nurses can provide to their patients. But let's focus on that first point, which is lowering costs. I wrote underneath empowering the patient, as I already stated, it puts power into the patient's hand, but it really gives them that sense of putting their health into their own hands, and we'll see that in a second. But first, I found this quote by Barbara Bowman, who's the director of the CDC Division of Heart Disease and Stroke Prevention. It says, Americans suffer from 1.5 million heart attacks and strokes each year, a burden that continues to the more than $320 billion in annual healthcare costs and lost productivity caused by cardiovascular disease. And that is an insane amount of money that we're spending on a disease that is completely preventable. The leading causes for cardiovascular disease are inactivity, overconsumption of food, and bad habits such as smoking and drinking. Now, if we were to be able to eliminate these barriers that lead or create barriers to not allow people to reach that point, we would save money and lower the cost of healthcare and be able to put that $320 billion towards something else, with cancer research, anything. And it would be money better spent than having to take care of people who can't take care of themselves. But with wearable devices, they will be able to take care of themselves. So I'm going to restate that point of why wait till something is broken to fix it? And why wait for someone to be that sick to where they have to have a heart attack or a stroke to get to the hospital for us to take care of them? Why not implement measures or create a greater access for these devices so that people who are at risk can get help before they are, critical? Levels of inactivity are a great component to the rising costs of healthcare and with chronic disease. Wearable devices can monitor patients' progress and activity, having to implement measures or apply expensive alternatives to tracking their progress. Due to the diverse amounts of methods that this product can calculate and measure patient's activity, it can translate to a better outcome for the patient, because having not just one way to do something, having multiple ways, it gives them a greater chance to follow through with their treatment. Allowing the device also provides daily, weekly goals to ensure that the person stays on track. It sends you reminders to have this X amount of steps. It gives you feedback each day on how you did, and it allows you to self-monitor yourself. And it gives you visuals to see how many calories you ate, how much you worked out and expended those calories, to see really a trend upwards or downwards, and for you to, calculate on yourself, see where you're going wrong. And they provide promising approaches to healthcare and allow them to diagnose monitor an early diagnosis and create personal treatments unique to that patient's needs. Now, the second point is establishing a community of support. Together we thrive. Now, I don't know how many people have been part of a team before, but if you're tackling an obstacle such as, let's say, weight loss alone, you're going to hit a lot of bumps. And if you're not prepared to take those bumps, the odds of you quitting or just resisting are a lot higher than if you have a team around you giving you the support and encouragement you need at that moment. And these these wearable devices can provide that for patients. Online communities can provide support and encouragement for those who need it in order for them to keep going and for them to pursue their goals each and every day. A study of 150 people showed that between groups of people that went to a weekly weight loss seminar, like group, like Weight Watchers, versus some people who went to an online forum for weight loss, over 24 months, they lost the exact same amount of weight. So and they did lose weight. So that shows that it doesn't matter how you get support, you're still losing weight because of it. It's a great form of sticking to it. And in addition to that, to further complement that, sorry, another study of about 450 people determined that between those who didn't use smartwatches to lose weight and those who did use smartwatches, those who used the smartwatches correctly and used the app and tracked everything over 24 months lost significantly more weight than those who didn't use smartwatches. So putting those two together, you can see that wearable devices can create a great impact in people's lives and can have a sense of community around them. You know, weight loss isn't easy. Any behavior change isn't easy, but if you have someone else there that can, you know, provide that extra push for you when you can't, that goes a long way. And you can also ask certain questions about, you know, you could post stuff like, what techniques work, what exercises, what food should I be eating, and patients can use this too. They can, you know, provide support for themselves, people who are out already, or can inform patients who are coming in, like, hey, this is what I went through, this is how you should, like, you know, this is what worked for me, this is didn't, like, try this, try not, and it can form a sense of, you know, of a bond, really, with people who, you know, your family might not understand exactly what you're going through, but other people do, and, you know, that can go a long way. So these are pictures of how these would look online on your computer and on your phone. It shows where to log your food, activity, track your weight. It shows the steps you've taken, calories burned, and your active score. And on the other hand, you have your phone, where that's a little bit more immediate, where you can see of your friends or your coworkers who's working more and working out more and who's stepping more, and you can kind of compete, and you know, it's a little bit funner, or a little bit more fun than just tracking your steps. And my final point is improved quality of healthcare. The more we know, the better we can help. So by having a day-to-day history of what each patient has been consuming and doing to their health, a doctor can give them the best treatment for that specific patient that will be a lot more effective than, let's say, them just coming in and the doctor guessing, you know, or someone just telling them an estimate of what they've eaten in the last couple of days and what their diet's like. You know, they'll have that log, that track. By combining all this health and non-health data, doctors can suggest better behaviors and improve those with chronic diseases. Sorry. If my last point, conditions can be improved through wearable device, such as depression, sleep apnea, and Parkinson's. And these can be all measured in different ways. Depression can be monitored specifically through the sleep schedules, the heart rates, and its activity log. If the person isn't really active in anything, it kind of can show signs, or, you know, send a little notification at least. Sleep apnea, by tracking the sleep, and, which was very interesting to me, if the wearable device is set up for it, through the micro movements in a person's wrist or body, one can determine and help those with Parkinson's disease early on and as they have it. Now, I wouldn't suggest that hospitals incorporate full-on Fitbits. That would be extremely expensive. But if they were to create their own line of wearable devices that would just monitor heart rate, sleep, and some sort of like calorie expenditure, they can monitor patients before they come in or even while they're in the hospital being treated, and see if something spikes, they can go help them out. And once they leave the hospital, if they are having some sort of troubles, they can see how far into it they went wrong, and they can see, have you been taking your meds? Have you been engaging in some sort of like heavy activity, and so on and so on. So in conclusion, wearable devices not only help users incorporate better habits into their day-to-day lives, but they also can provide numerous benefits to the healthcare world, such as, like I said, the lowering costs by preventing a lot of diseases and lowering the overall cost of healthcare for everyone. It also gives people a sense of community by giving each other support and, along the lines, improving their health because they're joining forces with others, and to allow doctors to give everyone that unique care, that extra push that they might be needing to get to the next level of their health. And so with that said, here's my reference slide. I'd like to thank everyone for tuning in, and I wish you all a wonderful night. See ya.